Dynomed, a leader in patient information media, presents this video on hip replacement surgery in order to help patients and their families understand their condition and its management.
I was diagnosed in my late 20s, early 30s with osteoarthritis. I was put on an anti-inflammatory drug, lived pain-free for many, many years. What started it up and made me progressively worse, I don't know.
Hip replacement surgery, also known as hip arthroplasty, is a technique that has become quite widespread in recent years in response to the need to effectively improve hip joints that have been severely damaged by injury or some form of arthritis. When other, more conservative methods of treating disabilities in the hip have proven inadequate, joint replacement surgery may represent the best hope for long-term improvement to the hip joint.
My hip hurt so badly that I just could not function. So I went to see an orthopedic surgeon, and he examined me, had x-rays taken, and determined that it was time for a hip replacement. There wasn't anything else that could be done at the time.
The human hip, like the shoulder, is a ball and socket joint in which the ball of one bone, the femur or bone of the upper leg, fits into the socket of another, the pelvic bone. As the most flexible free-moving joint in the body, the normal hip can move backwards and forwards from side to side and can perform twisting motions. Like other free-moving or synovial joints, the hip contains a small amount of fluid which lubricates the joint whenever you move it. It is held together with ligaments, straps of tough, sinewy tissue, which help prevent the joint from dislocating. Full function of the hip joint depends on the successful coordination of many interrelated parts, including bones, muscles, tendons, ligaments, and nerves. In hip replacement surgery, the diseased portion of the hip bone is cut away and replaced with an artificial hip joint consisting of a socket on the pelvic side and a ball and stem device on the movable femoral side. Total hip replacements are usually performed for severe arthritic conditions, especially osteoarthritis, but may sometimes be recommended in the case of hip fracture or avascular necrosis, also known as osteonecrosis, a condition in which the bone of the ball portion of the hip dies. While most patients with artificial hips are over 55 years of age, the operation is occasionally performed on younger people. Let's take a moment to consider the impact of injuries and arthritis on the hip joint. The joints of our bodies are cushioned with a material called cartilage, and as we age, normal wear and tear, or degeneration of the cartilage, takes place in most joints. In osteoarthritis, the cartilage cushioning the bone surfaces wears away, causing the bones to rub against each other in a painful way. Another form of arthritis, known as inflammatory arthritis, occurs when the body's own immune system attacks the synovial lining of the joints, just as it would a foreign bacteria. Traumatic arthritis results when the joint or the ligaments surrounding it are damaged by fracture, dislocation, or accident-related injury. All arthritic conditions result in stiffness, swelling, and the loss of motion. It becomes difficult to put pressure on the hip, and the joint becomes increasingly tender and swollen. As time passes, arthritis of the hip can significantly affect your ability to walk.
My hip was so sore and hurt so badly that I was really having much difficulty getting in and out of the car, out of a chair, going up and down steps. I just didn't want to do anything or go anywhere.
Hip injuries, including arthritis, can usually be detected fairly easily during a routine doctor's exam. If total hip replacement surgery looks like an option, your physician will refer you to an orthopedic surgeon experienced with this procedure. Many people with arthritic conditions manage their discomfort with non-surgical treatments, including proper medication, physical therapy, exercise, rest, and joint protection. If these conservative care methods do not seem to go far enough, surgery is the next option. Pain relief is the most reliable potential benefit and often the major reason for surgery. For most people, hip replacement surgery also offers better movement, strength, coordination of the torso and leg, and an improved appearance of the limb. Most people who develop a limp in order to cope with the pain of an arthritic condition will no longer limp after surgery. Hip replacement surgery may mean the difference between having to use a walker or cane and being able to walk, climb stairs, and maintain a relatively active and independent life. Before any kind of surgery, it's important to have other health problems under control. If you suffer from lung problems, prostate problems, heart disease, a bacterial infection, or other conditions such as diabetes, surgery may aggravate these problems. Being overweight can also produce complications, as does smoking and the use of alcohol or drugs. Patients who are about to have any form of total joint arthroplasty should be in good dental health, scheduling any necessary dental care prior to surgery. Total hip replacement surgery requires a good deal of planning. Surgery is performed by means of open incision. A typical operation may take 1 to several hours. The diseased ball end of the thigh bone, the femur, is removed so that the socket can be seen. The bony socket is fashioned to contain a new metal and/or plastic socket. This prosthesis is usually made of medical-grade plastic and is the bearing surface. Titanium or cobalt chromium alloy are metals commonly used in prostheses for joints in the body. The femur is then prepared for the metal stem and a smooth metal ball is attached. The ball is then placed in the plastic socket and the surgery is finished. A bone cement may be used for either or both stem and socket. Physical therapy begins quite soon after hip replacement surgery.
My rehabilitation started the day after surgery. I went down for physical therapy. They taught me the exercises using stairs and things that I would use at home and continue to do after going home.
There are a number of things to watch for after any form of surgery. Call your doctor if you notice any drainage or foul odor from your incision, or if your temperature rises to over 100.4 degrees. Your doctor should also be notified of any increased tenderness, redness, or swelling. The incision can be cleaned once a day with regular soap and water and then dried carefully. If redness or drainage from the wound is noted, please notify your physician immediately. Major surgery like hip joint replacement requires a period of adjustment. Take it easy during this time, trying to focus on the healing process and in gradual, practical improvements to your general condition. People who have joint replacement surgery of any kind must be particularly cautious about infection. It is necessary, for example, to always tell your dentist or physician that you have an artificial joint. Having a large metal implant in your hip may sometimes set off metal detectors in an airport or at a public event. Your doctor can provide you with a card identifying you as a patient with an artificial implant. Hip replacement surgery is an elective procedure that is nearly always successful in improving the strength and decreasing pain in a disabled hip joint. Although this surgery is usually without any significant problems, there may occasionally be unforeseen complications associated with anesthesia, including respiratory or cardiac malfunction. The procedure itself may be complicated by infection, injury to nerves and blood vessels, fracture, weakness, stiffness or instability of the joint, pain, or the need for additional surgeries. Another complication that can occur is a dislocation. Moving the hip in certain ways can cause this, and you should be aware of proper precautions to prevent this. Joint replacements cannot be expected to last forever. On average, they last 10 to 15 years. Occasionally, an artificial hip will become painful, making revision surgery necessary. This may be caused by loosening, plastic wear, or infection. Many variables affect the ultimate success of hip replacement surgery, including the strength of the patient's bone and musculature, his or her general health, including mental and emotional health, and lifestyle. Commitment to rehabilitation is a key part of the process, as improvement to the hip joint is determined not only by surgery, but also by rehabilitative effort.
My quality of life since the surgery has improved so much because I feel so much better. The pain is gone.
With a positive attitude and dedicated effort, you can significantly increase your chance of an excellent outcome. Dynomed, a leader in patient information media, is proud to have presented this video on hip replacement surgery in order to help patients and their families understand their condition and its management. Dynomed, offering effective patient education in a changing environment.